It's not just Sydney's safety at stake, but the entire nation. That was the Premier's blunt warning as she revealed the city's COVID crisis is now deeper than ever. Gladys Berejiklian is calling this a national emergency. And here's why. There are 136 new cases. More than a third of these people were infectious in the community. Another 17 were out and about for some of the time. And tragically, a man in his 80s has now died. In response, tough new rules are coming in for the Cumberland and Blacktown council areas. From midnight, only authorised workers will be allowed to leave the zone. So that's more than 600,000 people joining those in 3 other LGAs with similar restrictions. With the prospect of this outbreak dragging on for months, New South Wales is pleading with other states to give their vaccine doses to Sydney. It's been another day of big developments. We have all angles covered. Cayman Gock leads tonight's coverage.
Thousands heeding the call to arms, but despite Sydney's best efforts, the city's losing its battle against Delta.
I have advised the government today that this is a national emergency and requires additional measures.
4 weeks into lockdown, yet another day of records. As the COVID crisis worsens, it's becoming clearer the rules won't be relaxed anytime soon.
I think it's the worry of, will I still have a job at the end of all this if lockdown goes any longer?
We can't really lock down indefinitely. We have to have a plan, have to have a figure, have to have a strong strategy to follow through.
But living freely is likely months away.
According to the federal vaccination rollout, by the end of October, we will be at a stage where much more of our population will be vaccinated and we'll be able to live much more freely beyond that point.
So until then, a targeted response will be deployed to crush the virus, starting in the Blacktown and Cumberland LGAs.
We don't want any workers leaving that area unless they're regarded as critical workers.
The Premier concedes the state can't recover from this emergency on its own.
From today, the New South Wales government will be calling on the federal government to refocus our national vaccination strategy.
She wants mass vaccinations for southwest Sydney to slow the spread of this highly infectious strain, urging people to roll up their sleeves for either Pfizer or AstraZeneca.
I want to see them today. So let's be very clear. My sense of urgency is absolute urgency.
The key to keeping the economy going is vaccinating critical workers under 40, but a plea for help from interstate is falling on deaf ears.
I'm not wanting to send any of our vaccination doses anywhere else.
We have barely enough vaccine allocated to any of us.
And has quickly been dismissed by those in charge of the national rollout.
We are not going to disrupt the vaccination program around the rest of the country.
Suddenly deciding to throw a particular vaccine at one geographic area does not give you an immediate solution. At the moment, we don't have surplus Pfizer.
But there is a lot of AstraZeneca, and while it's currently recommended for over 60s, doctors want that to change.
It may be time for clear advice to all young Australians in Sydney that AZ is a very safe and effective vaccine.
That may prove to be the fast track to freedom.
We'll be working hard over the weekend and early next week to provide a roadmap.
A roadmap desperately needed.
And Cayman Gock joins us live now from the mass vaccination hub at Olympic Park. Cayman, the Prime Minister made it clear this afternoon we won't be getting anyone else's vaccine doses, but there may be another solution.
There is, Jeremy, and that's by increasing the time between Pfizer doses from 3 weeks to 6 weeks, which is within the health guidelines. What that does is it gives authorities more time and supplies to administer first doses. It's desperately needed too. Take a look at the queues that have lined up here today. People have come out in droves to get vaccinated, and the state government only wants those numbers to grow. The Prime Minister did also flag that if in the future extra doses become available, the federal government will give them to New South Wales, but it's unlikely to be a significant amount. Jeremy?
Cayman Gock, thank you. Let's go further west now. Kathleen Calderwood is in Blacktown. Kathleen, it's not long until the new rules come into force there.
Yes, Jeremy, from midnight, the local council areas of Blacktown, where I am, and Cumberland will be locked down even further. Like Fairfield, Liverpool and Canterbury Bankstown, only authorised workers will be allowed to leave, but they won't have to take part in surveillance testing every 3 days as the state's clinics are starting to reach their daily capacity. The Premier says the harsher restrictions are necessary to stop the virus spreading even further into Western Sydney.
Another day, another suburb on alert. The streets of Blacktown will soon be even quieter.
I think it's all right. People have to don't leave the area. Yes, because it's gonna put the virus everywhere.
Now we're only living off one paycheck, so that's, back in Centrelink again.
Only authorised workers from Blacktown and Cumberland will be allowed to leave the council areas. That includes supermarket and pharmacy staff, emergency, health and aged care workers, and those employed in manufacturing and transport.
We need to up the ante. All of us need to be much more disciplined in dealing with this pandemic, dealing with this plague. And I would urge everybody to go and get vaccinated ASAP.
We also need to work very closely with the impacted communities and leave no stone unturned in terms of the support we can provide people.
Community leaders say that help can come in a variety of ways.
Community needs a lot of practical support to start with. Digital access remains a barrier where large numbers of family members have to share small spaces.
Not only is Blacktown the biggest council in the state, it's incredibly diverse. More than 180 languages are spoken here.
There seems also to be a lack of trust in central systems and information, so people are turning to their local trusted community leaders.
The answer to the issue for all of us, we need to get that message across to our diverse communities that COVID is a killer.
An urgent challenge for leaders at every level. Kathleen Calderwood, ABC News, Sydney.
The police minister is demanding councils close some of Sydney's most popular beaches. Let's bring in crime reporter Mark Reddy, who's at Bondi Beach. Mark, why does David Elliott want the sand blocked off?
Well, Jeremy, this gym here in Bondi is among the places he's referring to. He says far too many people are gathering here and they're not socially distancing and that masks should really be worn. He also says this outdoor equipment should not be shared, and he's also expressed concern about the Bondi to Bronte walk, saying far too many people are frequenting that route at one time. But really, he took a swipe at Waverley Council, accusing it of not having a COVID-safe plan.
We've asked them to close the beach down until they can manage the pedestrian traffic in a way that it is both in compliant with the public health orders and also safe.
The Mayor, Paula Masoulis, has rejected those claims, saying the majority of people here are doing the right thing and that it's important to consider mental health and that so far beaches will remain open. Across Sydney, 248 fines were handed out, 73 for not wearing masks. And Jeremy, just like those case numbers, police say that number really needs to come down.
And Mark, police have rejected an offer of help from the Defence Force.
Yeah, so the Premier phoned the Police Commissioner Mick Fuller and passed on an offer from the Prime Minister of military assistance, but he rejected that support because we know an operation is already underway in southwest Sydney that began 2 weeks ago, and he said that community transmission is really being passed on through household contacts as opposed to on the street, just like we saw during the last lockdown and the start of the pandemic. So he thanked the Prime Minister for his support, but so far won't be taking up that offer.
Mark Reddy reporting from Bondi Beach. The surging crisis is leaving more and more people needing urgent care. There are now 137 people in hospital, 32 of them are in intensive care. 14 need a ventilator to help them breathe. 24 of those in hospital are under the age of 35, and there are people in their 20s and 30s in ICU. 3.3 million doses of the vaccine have now been given in New South Wales. There's also an alert for potential new problem areas. For the first time in this outbreak, virus fragments have turned up in sewage testing on Sydney's North Shore and in Byron Bay. That's got health authorities worried. It comes as people in the state's north readjust to a closed border with Queensland.
When the border is slammed shut, locals know to expect gridlock.
We have to resolve this. This is just totally insane.
As part of the border bubble, they can apply to enter Queensland, but police are screening every vehicle.
Talking to other business owners, they are so devastated. They are so disappointed at what's happening here.
Further south, Byron Bay is on high alert. Virus fragments have been found in wastewater.
I think everyone's really worried. Obviously, that doesn't pop up for no reason.
Maybe it's our time for a bit of a lockdown, but I don't feel good about it.
The Southern Tablelands has also had a wake-up call. A confirmed case visited Bunnings in Goulburn and the KFC at Marulan. In the Hunter, officials are worried about out-of-work Sydney tradies coming to the region.
Our local community's been very fortunate in avoiding having the Delta variant spread in our local community, and we want to keep it that way.
The Central West is relieved no new cases have been found on the third day of its lockdown, but authorities say high rates of testing are still crucial.
We need that number to stay high and for us to be confident that if there is COVID circulating around our region, that we can get in front of it and stop it as quickly as possible.
Back in Byron Bay, locals are a long way from Sydney but remain vulnerable to COVID-19 and are hoping it hasn't somehow crept into the community. Hannah Ross, ABC News, Byron Bay.